Join me as I perform a little perioral rejuvenation for this patient. Now, during this session, we're going to do a little nasolabial fold, marionette line, and lip filler. And then the next session, we're recommending a little bit in the pre-jowl sulcus and maybe the jawline. So prior to starting, I always mark out all of my areas with the patient sitting completely upright so that gravity plays a role. So now I'm going to start injecting the nasolabial fold. I'm using a 25 by 1.5 inch cannula. This cannula is the workhorse of my entire day. I use it all day long. It can get me far and wide, make me feel a little bit safer, and it doesn't have a lot of flex in it like a 27 gauge does. So 25 by 1.5 inch, I love for nasolabial fold and marionette line. So I'm just working my way up to that piriform aperture and laying small retrograde threads. When you're working your way in the nasolabial fold, it's important to let them know that they'll feel a little jolt of discomfort when you get to that little nasal ala area because of those infraorbital nerve branches right there. There's little fibers. It's kind of a tight compartment. So I always tell them you might feel a little discomfort when I'm trying to break through those fibers, but nothing's wrong. It's just kind of a normal feeling that most patients experience. So now working on the marionette line, I always, like I said, mark them sitting upright, and then so that I can mark out all of those little deficits in her marionette line. So when I'm injecting the marionette line in the chin shadow, I'm going directly into that hollow and laying small retrograde threads. In this area, it's a little bit more prone to bruising, so I want to make sure that when I'm hitting those little fibers, I'm just knocking on the door and letting them in. Newer injectors with cannula always have a tendency to get a little anxiety when the cannula doesn't slide right through, but your skin and tissue are made up of millions and millions of fibers that you just have to kind of work your way through. So I always take my time. I go back and forth into every area. You'll never see me lay this thick thread of filler. It's always just these small retrograde threads, and then I blend that filler in, making sure that I'm always massaging that filler. You could see it's already softening up that nasolabial fold and marionette line. I did set strong expectations for this patient that we're not going to completely get rid of those folds, but we will definitely soften the shadows of them. And like I said, in that second session, we're going to do a little pre-jowl sulcus to soften the appearance of that marionette line, of that jowl to chin, that little disconnect that she has in that pre-jowl sulcus. But we're limited to about 2 syringes, so I wanted to do nasolabial fold, marionette line, and lips today, and then we'll bring her back in. So laying those small threads, but look right here, you can see how beautifully it's already softening. Look at her right side, nasolabial fold and marionette line, and her left side. You can dramatically see that difference with just a little bit of filler. So now working on the left side of her nasolabial fold, working my way up to that nasal ala, I always want to make sure that there's a good amount of tissue overlying the cannula. If you can lift that cannula up and completely see the outline of the cannula, you're a little too superficial. I like kind of like a blanket sitting over top that cannula. So I'm just working my way up to that nasal ala, making sure she understands she might feel a little discomfort as I push past those fibers near that nasal ala, and then I'm laying small retrograde threads, but really taking my time. I typically start with cheeks and then decide to do the nasolabial fold, but for her, she has a beautiful cheek, so it made sense to go directly into the nasolabial fold. So now with the cannula and the marionette line, my first poke for every cannula work is always a little bolus of lidocaine and bicarb, and then I use my little starter or pilot needle to create that introducer pilot hole and then insert my cannula. So my starter is usually 23 gauge and my cannula is a 25 by 1.5 inch. So here just laying those small retrograde threads, always being mindful. That oral commissure, I like to make sure I get as close as I can to it to really build support in that oral commissure. I'm using Evolysse Form here, which I've really been enjoying. It's one of the newest fillers on the market, and I've really been enjoying this product for the nasolabial folds and marionette lines. And this is the bread and butter of my patient demographic. I work in the villages part-time. So my average patient is 60, 70, even 80 years old. But look at how much softer those nasolabial folds and marionette lines are. So now we're going to work on her lips. I'm marking out, I always like to mark out the Cupid's bow because when I inject from behind, it can kind of disappear when you're injecting them. So laying small retrograde threads of Evolysse Form. So this whole treatment is done with Evolysse Form, nasolabial fold, marionette line, and lips. And for her, she in her more youthful years had such a beautifully full lip that honestly it made my job really easy, because typically a woman of her age loses a lot of that shape in her lip. She's been able to maintain that shape, but she's just lost the density to her lips. So they appear a little bit dry, but for her, we're just hydrating the lip. I'm really not trying to add too much volume for her because I think it could take her out of balance. And at her age, I don't think a dramatically full lip looks right. So for her, I told her we're just adding a little bit of hydration to the lip, and you can already see it start taking shape. Form has been beautiful for the lips as well. I love honestly adding a little half syringe for this mature demographic, and it really just hydrates the lips so beautifully. I'm using a 32 gauge needle here for these injections, and look at how beautiful her lip is taking shape. And she's such a rock star. She's barely even moving. So just laying those retrograde threads. When I'm injecting the sides of the lips, the more lateral part of the lips, I always move my needle so that it's more horizontal, because I don't want to add height in the side of the lip. I just want to add a little hydration and make sure that the corner or lateral part of the lip blends into those tubercles. So you can see how beautiful these lips are coming out. I absolutely love them, especially for her age. It really is so rare to have such a crisp, beautiful shape. We really lose that as we age, losing collagen and elastin, all of that. Look at how beautiful these lips are. She is so wonderful, barely flinched, and I love it when a patient says, "Oh, wow," after they see their transformation, and she goes, "They're back," or "She's back." But she's so honestly wonderful. Look at how refreshed and rejuvenated she looks. She doesn't look any different. It really is just softening those shadows in her perioral region. And then next session, we'll probably tackle those pre-jowl sulcuses or sulci, and then a little bit in the jawline for her.